Hey guys, this is a little ISO sequence, which is isometric sequence. We're going to be doing a 10-second passive stretch of a tissue. Then we're going to contract the tissue we're stretching, and then we're going to contract the tissue we are shortening. Repeat that again. You can do that up to 3, 5, as many times as you really need to. It's a really great way to warm up tissue, to get it really, really warm, to get the joint, the capsule warm. We're going to do it here for internal rotation in the hips and shoulders, and we're also going to work on flexion of the lumbar spine. So we do 10-second passive stretch, 10-second contraction of your tissue you're lengthening, and 10-second contraction of your tissue you're shortening. We're going to start with our forward fold. This is a really, really simple forward fold. We're going to come all the way down. This is for our lower back. Hands are going to go underneath or behind your legs here. And what I'm going to do, you grab that forearm, is we're going to pull the spine up. So I'm trying to make this whole spine push up towards the ceiling, but my arms are locked behind my knees and blocking me. So we hold up there for 10 seconds. Nice gentle stretch. So this is not as hard as you can go. A couple breaths here and out. If you need to, bend your knees, completely fine. Whatever range works for you. We're going to start to contract up. So we're going to ramp, pushing our shoulders, our lower back up towards the ceiling. We're ramping this up to our greatest effort, 20, 40, 60, whatever's comfortable. If you can go up to 100, by all means. Hold that for 10 seconds. 5, 4, 3, 2, 1. Maintain where you are, and then actively try and pull yourself in. So think of your abs pulling towards your knees, but I want you to maintain that level of stretch through that spine, so we're still holding it where it is. Holding that again for 10, 5, 4, 3, 2, 1. Second set, breathe. Just 2 big breaths in here. And out. And in. And out. Start pushing up again. So spine, all of your back is pushing up towards the ceiling, ramping it up to your greatest effort. 20, 40, 60. Hold there. Hold. 5, 4, 3, 2, 1. Maintain where you are, and abs are gonna try to crunch towards your knees. Hold. 5, 4, 3, 2, 1. Breathe and release. What we've gotten is you might feel that lower back, you might feel it upper back. It's wherever your spine is tight. You might even feel it just hamstring. That's absolutely fine. Second one is shoulder internal rotation. We're gonna find a wall. You can do it seated or standing. We're gonna have our arm 90 degrees, drop it slightly below, right? I'm putting my right hip towards the wall. Same thing if you're sitting down, put your right hip towards the wall. This is my right arm. I'm gonna then actively go into my internal rotation. So I'm going down, pivoting at the elbow, trying to go down towards the wall. When I reach that end range, then I'm gonna grab my other arm, grab the forearm, not the wrist, and try and pivot a little bit more. Where you find that end range where you're gonna get a stretch on that shoulder. Hold that for 10 seconds, breathing in and out. We're gonna do a pail. So my right arm is going to push away from the wall into my hand, ramping it up. You're not gonna let it move. It stays exactly where it is. 20, 40, 60, 80. Hold your greatest effort, trying to push away while your left arm holds you where you are. I don't want any movement. 5, 4, 3, 2, 1. Actively reach for the wall. So when we do this, the shortened tissue is contracting and my right arm is trying to go towards the wall, and I should be able to take this off if I've actually contracted, and it should stay there. Hold. 5, 4, 3, 2, 1. Replace the hand, find the stretch again, go further and hold there into that stretch for 10 seconds. We're gonna breathe. And out. Calm your nervous system. One more breath. And out. We're gonna start pail. So my right arm's gonna push away from the wall into my hand. 20, 40, 60, 80. Greatest effort. Hold that. Hold. 5, 4, 3, 2, 1. Reach for the wall. Slowly take this hand off as we're reaching for the wall, holding. 5, 4, 3, 2, 1. Relax that down. Good. And breathing in and out. Same thing on the other side. So I'm going to show you a little bit from behind here. We'll see if we can see and what we can see. So our arm, 90 degrees, slightly below. My left arm is reaching towards the wall, finding my end range. Right arm comes on top. And we're going to hold for 10 seconds, breathing in and out. And in and out. Start pushing away from the wall into your right hand, ramping up to your greatest effort. 20, 40, 60, 80. I'm intensing my other leg, my right leg, and trying to push it into the wall so I can create this irradiation tension through my body. And start contracting the other way. Hold towards the wall. So I'm reaching towards that wall, working as hard as I can. 5, 4, 3, 2, 1. Make it all go passive. Relax. Breathing in and out. Good. Start pushing out into your hand. 20, 40, 60, 80. Greatest effort. Everything you got pushing out. Hold. 5, 4, 3, 2, 1. Reach for the wall. Reach for the wall. Slowly take that other hand off. Reach for the wall. Hold. 5, 4, 3, 2, 1. Breathe and relax. Nice and easy. Last one we're doing in this iso is our hips. We're going to be supine or lying on our back, and our hip is going to be out a little bit, and then we're going to internally rotate. So I'll take you through that. I'm going to go here. My right leg, my left leg's just going to relax where it is. I'm going to pop that internally. I'll go a little bit further away. So I'm going to take my foot, bring it out slightly, internally rotate, and then I'm going to use my left foot to just put some weight to make that passive stretch. So my right leg's not doing the work, it's trying to relax. My left leg is going on top. We're going to just let that relax for 10 seconds, breathing in and out. One more and out. Now my right leg is going to try and push away from the floor up, and my left foot is going to push down. We're going to not allow that to happen. So right leg ramping up. 20, 40, 60, 80. Holding there while your butt stays on the ground. Hold. 5, 4, 3, 2, 1. Right leg is reaching for the floor. You should be able to take that left leg off as the right leg is actively going down inwards towards the floor. Holding. 5, 4, 3, 2, 1. Replace the leg and let it go passive for a couple breaths. The further you put that left leg over on this leg, the more weight, the more you'll be able to stretch further. So just go with what you can. Breathing in and out. We're going to do our second set of pails. Right leg is pushing up, left leg is stopping it from moving. Ramping it up, greatest effort. 40, 60, 80, everything you got. Hold. 5, 4, 3, 2, 1. Rails, reach for the floor while you should be able to lift that off, and this right leg stays exactly where it is. Hold. 5, 4, 3, 2, 1. Breathe. You can feel that stretch. We're going to do the same thing on the other side. So my left leg is now out and internally rotated. My right leg comes on top, makes it passive. We find that stretch, so I'm pushing down my knee while trying to keep my bum back on the ground so that you feel it through, under, into your hamstring, around your hip joint, into the front, wherever you're tight. Breathing in and out. We're going to start pushing up. My left leg is pushing up towards the ceiling or out, and my right leg is not allowing it. Hold, ramping it up, greatest effort. 60, 80, greatest effort. Hold. 5, 4, 3, 2, 1. Rails, reach for the floor. The right leg should be able to come off while this left leg is actively reaching down towards the floor. 5, 4, 3, 2, 1. Replace that right leg on top, make it passive. Keep your butt sinking towards the ground. Take a breath in and out. One more breath
and out. We're going to start ramping up. Your left leg is pushing up into that foot. 20, 40, 60. Don't allow it to go anywhere. 80, greatest effort. Hold for 10, 5, 4, 3, 2, 1. Rails, reach for the floor, lifting this off. Reach, 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 reach. Hold. 5, 4, 3, 2, 1. Breathe. And we're gonna pull out of that and come on up. That is your iso. We did internal rotation shoulder, same internal rotation of the hip, and we did flexion or forward folding of the spine, trying to get that spine to open up. You do 10 seconds stretch, 10 seconds contract the tissue you're stretching, and 10 seconds